Hello and good evening to everyone. This is a Sunday special. Normally, we do these interviews on a Saturday, but this was such an important point and the decision about the WHO pandemic treaties coming up that I thought it would be worthwhile bringing back one of our internationally acclaimed experts, Professor Amitav Banerjee from India, to share some of his thoughts about it. What I'll be trying to do in this discussion is to highlight what basically the treaty is about. I'm going to share one of the clips from a lawyer from the WHO who explains what they're trying to achieve with the pandemic treaty. I'll be sharing some of the details from an updated version from the House of Commons in the UK and discussing some of the risks that are associated with, certainly from Professor Banerjee's point of view. So, without further ado, let's just add to the stage here Professor Banerjee, Amitav. So, can you just do a quick introduction of yourself to the audience?
Good evening, Philip, and good evening to everyone. It's a pleasure to come on this platform. I am Dr. Amitav Banerjee. I am a professor in epidemiology. I was earlier in the Indian Armed Forces as an epidemiologist, and since the past 20 years, I am working in academics. And during the COVID pandemic, I was associated with some sero surveys, with contact tracing, and with studying the epidemiology and analysis of big data about the pandemic. And I am also a bioethicist. Since past decade or more, I am chairing number of ethical committees. So this pandemic treaty caught my attention, and I've been studying the ethical aspects of this treaty. So I'm happy to exchange my ideas on this platform.
Excellent. Thank you, Amitav. Now, this is a big deal. Now, what I'll start off with, just so people are aware, is that there is a lot of information out there. This here that I've got is the House of Commons, a WHO pandemic treaty. This was done on the 16th of May, 2024. I'm going to come back to it in just a minute. But I think that one of the reasons this came up, and it was, I think, Boris Johnson, the UK Prime Minister at the time, who had pushed for this to come into being. And I think the main thing started because there was a concern that there was no equity with regards to vaccines at the time of the COVID pandemic. So let me just remind the people, in case people are not clear, at the time when the vaccines came out, they were primarily used in the first world countries. And they were able to go on to young people, the low risk cohort, children, before they got out to many parts of the developing world and, say, Africa. This seems as though I think we realized that this was a big issue. And what were your thoughts at the time, Amitav, when these things were happening?
Definitely, Philip, this equity is a major issue. And of course, in this pandemic, when the vaccines were rolled out, a number of developed countries, they hoarded a large amount of vaccines, and there was not enough for many of the other countries, particularly Africa, part of Asia. But this was, as a afterthought. Perhaps it didn't affect them as adversely as it might have if that had been the only way to end the pandemic. I mean, as events unfolded, we found that highly vaccinated country also, they kept on having the number of waves. So we have to, I mean, this vaccine is one aspect. So instead of vaccine, we can say the health resources or health manpower resources, even drugs. For each pandemic, it will depend. If we are thinking of a treaty, you can't it would depend whether vaccines work in that pandemic, whether drugs work in that pandemic, or whether you oxygen is required, whether other health resources are required. So equity should not be focused only on vaccines.
Yeah. Mhm. Absolutely. So, and truthfully, what was proposed, so this was from March 2021, the main goal of the treaty was to foster an all government and all society approach, strengthening national, regional, and global capacities and resilience to future pandemics. And so they were looking at greatly enhancing international cooperation to improve alert systems, data sharing, regional, local, global production and distribution of medical and public health countermeasures, such as vaccines, medicines, diagnostics, and personal protective equipment. That's a good aim.
Yeah, that is good. I mean,
Why would there be a problem with that?
no, there is no problem with that. So, I mean, there is no problem with that. The problem are with the other issues, but whatever the reservations have been put up by some countries, which has stalled the passing of the WHO pandemic treaty. Actually, tomorrow is going to be decided whether the WHO pandemic treaty is going to be ratified by the World Health Assembly tomorrow. But according to the latest statements by the director, Dr. Tedros, they are having problems in reaching a consensus. And
Yeah.
paradoxically, these are the issues where they got stuck, which I don't find much issues with these, but the other issues are a little concerning. So
Yeah.
that is,
So I'll tell you what we'll do, Amitav. I'm going to share the views of one of Stephen Solomon, who is part of the WHO. He's going to put across, I think, as best as the public can understand their perspective. Then we'll come back and look at some of the risks and the issues that would exist in the context of the pandemic. So let's just listen to what he has to say. For the listeners, it's just about 5 minutes long. Listen to his opinion, and then we'll come back to the discussion afterwards.
Hi, okay.
This is Stephen Solomon, and he's one of WHO's lawyers. Stephen's got a stellar track of working on international health agreements, including influenza pandemic preparedness framework, or tobacco control treaty, and many more. Stephen is best placed to explain the legalities of the pandemic accord. So, let's begin.
Okay,
Great.
ready?
Thanks.
All right, here are some quotes for you to check out and tell our viewers what you think about it.
Okay, thank you.
The WHO are introducing a pandemic treaty that will mean they'll be able to take your tax dollars without listening to your opinion or giving you the chance to vote on it. Is that democracy?
Okay, this is interesting. Thank you. So there's no taxation in the treaty. The WHO is an intergovernmental organization. It doesn't tax. Only countries have the power to tax. But I think it's also important to say, and Russell Brand makes a very important point here, question is, who decides? He often asks that question. In this case, it is countries that will decide. So the treaty aims to do three things: better preparedness for pandemics, better prevention of pandemics from starting in the first place, and when they hit, a better, fairer public health response to those pandemics. And at the same time, making sure that countries which are in the driver's seat and are in the driver's seat for writing it remain in the driver's seat for all of those things. Okay, next video.
They want to give themselves surveillance power, determine treatments, vaccine mandates, vaccine distribution, vaccine intellectual property and profits, and they want to redistribute basically everything in the name of pandemics.
So first of all, surveillance power. The treaty won't give surveillance power to WHO. What it would do, the treaty hopes to do, is to make surveillance, public health surveillance, faster, better, more reliable. Also, the treaty isn't going to give WHO power to dictate vaccine mandates. The treaty won't give WHO as an organization, as a staff, the power to dictate anything. And it's important because WHO provides an independent voice, independent of any particular country, independent of any particular interest group. And so recommendations from us, which are based on science and evidence, offer countries a tool, if they want to use it, to help their response.
But the fact is that this rhetoric around we want a cohesive global response, that's all well and good. But you have to ensure that those kind of ideas aren't subject to potential corruption.
So Russell Brand puts his finger on a critical issue. One of the tools which WHO has, which is really important in this, and was invented by WHO, by the countries in WHO before the pandemic, is something with a long title. It's called the Framework for Engagement with Non-State Actors. Short title is FENSA. And what FENSA is basically, it's a fence against conflict of interest. So we have ways of engaging with all these external actors, which may have an interest in what we're doing to reduce, hopefully eliminate conflicts of interest. Okay, next.
They are a group that has superpowers, not because they're awesome and can like split wood like Captain America, but because they are immune to social order.
This is important to clear up. We have what's called immunity. The speaker is absolutely right. When we do our jobs, we have to know that we can do them independently. So if we talk about the importance of tobacco control in a country which has a lot of tobacco interests, we want our people to be able to work on tobacco control without fear that they may be in some sort of trouble or legal trouble if they're just doing their job. It's really important to question all of this. Any questions that you have in your mind that come up, you can drop comments below. You can.
So yes, so Amitav, you can see the perspectives. Now, if you pull back from that, is there anything he said there that you would be concerned about?
He made the right noises, all right, but the main things, I mean, it's just quoting. You see, the WHO International Health Regulations, that was in 2005, last amendment, that had just 75 pages, and now there are 300 amendments in 75 pages. And there are certain words, like earlier WHO was an advisory body. From the advisory, the many terms are used which are converted into binding. So it will have legal powers. It will have the authority to declare a pandemic or even an impending pandemic. And then the member states who sign the accord, who sign the treaty and the international health regulation, they will be bound by this. And each country will be having a rep designed to carry out the WHO's recommendations or binding. I mean, it is a recommendation, but the word used is binding. So recommendation and binding becomes a bit uncomfortable. And then the resources, each country will have to set aside something for the pandemic fund or some economic, some budget, which will take away from the country's own health priorities and the taxpayers' money. I mean, WHO may not be directly taxing, but the taxpayer will be taxed on the whims and fancies or in the judgment of the WHO, which will make a judgment for a country in Asia and Africa, which may have a different health priorities, which may have a different health competing. So that is the way which the public health is being practiced. It has to be a regional epidemiological practice based on the epidemiology of disease burden. Then the dictator, I mean, it's not dictating, it is, it will, in practice, it will be dictating. Then sovereignty of the countries will be endangered because movements will be restricted. The provisions are there in the pandemic treaty and the international health regulations that there may be restriction of movements, closure of boundaries, interstate boundaries, then vaccine mandates, vaccine passports. Another very disturbing is the censorship. There will be censorship of any alternative views to whatever the WHO experts. I mean, they will be only taken as the correct information, which we saw even in this pandemic which we faced, that without the WHO treaty, we had a lot of difficulties in, there was a lot of violation of human rights. There was a lot of unethical, I mean, lot of collateral harm without the treaty. And if the accord is regularized, if this treaty comes into force, it would be very difficult to really come to know what's happening. I mean, if you are not having the science progresses, I mean, this public health, you have to practice it scientifically. You cannot go on. I mean, the bureaucracy takes over then. The politics, bureaucracy, and the commercial interests take over. And the WHO has got heavy conflicts of interest because most of their funding are from pharmaceuticals. And therefore, other thing is social immunity. The Solomon says that the WHO should have immunity to from any questioning or from here. But on the other hand, you are not giving immunity to honest scientists, independent scientists. Even in this pandemic, we saw the independent scientists were deplatformed. They were labeled as not giving the correct fringe epidemiologists. And so it is a one-sided, and WHO or any big organization for that matter, even the organizations in the national level, they become bureaucratic and politicized. And then now the commercial interests are also there. And in this, the sort of symbiosis develops. I mean, mutually beneficial connections develop, which includes the, I would say, the academics also, because I have been in academics for almost 20 years. I am at the end of my academic career. So academics also get into this vested interest or the conflict of interest, because they get a lot of, the academic field is becoming very competitive nowadays. So they have to get the research grants, they have to do the research, they have to get new projects. And this, any pandemic or anything which causes comes into the public eye, that invites lot of money and grants and lot of things and career promotion. So everybody gets into this knowingly or unknowingly, and the pandemic treaty will be serving the interest of the very privileged people, whether they are privileged bureaucratically, politically, or even academic privileges.
I think that when I pull back from it and I reflect on the ethos generally about the equity and so on, this is very good. But you're right in terms of sound bites, because in my view, the most serious part of the pandemic, which is the origins of the virus, have not been clarified. If the WHO is unable to put pressure on the particular countries that may have been involved, it indicates that conflicts of interest exist, because that should have been addressed as one of the priorities. We are now 4 years down the line, and people are still arguing about whether or not it was a food market or a lab leak, and we don't, that's not acceptable. So the problem that you're raising with regards to conflicts of interest, it clearly indicates that if they were therefore to have that kind of power, they can be influenced. Is that wrong?
No, yeah, right. This conflicts of interest, I would, even as I said, even the scientists and academicians, they also get into this, I mean, sort of a partnership or I mean, and most of them may not see the big picture, what's happening. I mean, now the science is getting highly specialized. So a person working in a particular part of the pandemic or the disease, that person wouldn't know, like, what are the political fallouts, what are the bureaucratic, what are the other country. He or she is only concerned with his career promotion. And you have seen in this pandemic also, many scientists were really they suffered when they tried to find out more about it, or when they tried to question the dominant narrative. So that is which already the signals have gone that you have to somehow toe the line and don't question, and science decays if you don't question. And this type of treaties will decay the science of public health and science of.
So when I think about it, though, and I just need to remind the audience of the point that when we look objectively at what happened with the equity around vaccines, it truthfully was just purely about the fact that they got the science wrong. But if this had been a different disease, where the only option probably could have been a vaccine to prevent death, they would have wiped out the developing world because they hoarded all the vaccines to themselves. And I will challenge anybody who is pro vax. I did not hear any one of them arguing that you shouldn't be giving the low risk in their country and you should be sending these vaccines to other countries in the world early in 2021. Because remember, everybody high risk had gotten their vaccine in a first world country by April. Beyond that, they could have continued to spread it out to the rest of the world. They chose not to. I mean, there are some consequences of that, but it is purely just about the fact that the science was not fully understood. And if this was to happen again, they would do it again without some kind of commitment. How do we get around that?
Yeah, you're right, Philip. This vaccine distribution became an indicator of intent, I would say. It is an indicator of the selfish intents of the developed world, depriving the developing countries of their health resources, and vaccine is an indicator of one health resource. So, but this is silently happening without pandemic also. Most of the resources from the developing countries are including human resources. You see, most of I think in UK also, I think a large percentage of our NHS are manned by people of Indian origin, if I'm not wrong. So similarly in USA, and most of my students are going to these places. I have got my students in NHS and all those things. So we are losing and it happens with other health resources also. And vaccine is just one small aspect of it.
You know, and it raises the point, and I just want people to reflect on this, and people in the rest of the world need to think about it. At the moment, there are a number of drugs that in and around COVID have been absolutely put aside by the powers that be. They have not acknowledged the benefit of them. But should they suddenly acknowledge the benefit of them, they would do the same thing and take all these drugs from across the world and hoard them. And I think you were aware of what happened very early in the pandemic before the research started to discount the benefit of HCQ. They started to hoard it. Wasn't that right?
Yeah, large amount of hydroxychloroquine was sent from India also. We have got a large supply because that is used in malaria endemic in our country, then rheumatoid arthritis. And luckily it's a cheap drug, so there wasn't a lot of crisis of availability. But you are right, it could become a crisis if any drug is found to be useful in a future pandemic. They would be hoarding, definitely. But yeah, you're right that way. But the other issues are coming up, like those drugs may be effective and similarly other drugs, but the patent had expired. So there wasn't profit. So ultimately, the profit motive also has come up in this pandemic. The profit motive of private pharmaceuticals. And they are feeding the WHO as well as the bureaucrats and politicians, lobbying rather. And here talked of developing countries and Africa and India and other developing countries. One way to circumvent this developing countries, because they have large population. So if you promote vaccines and make it mandatory in the, say, national programs, the taxpayer pays for it. So the profit is ensured for the vaccine companies. So this is the other way they go around it, and that it subsidizes the price in the developed world. So that again is sort of a mechanism by which they will be promoting vaccines. Of
And
course,
it raises one of the important points, is that one of the sticking points from the pandemic treaty, because there are a few sticking points, is the fact that the developed world don't want to share their patent technology.
yeah, that's one reason by which the pandemic treaty got stalled, I think, because some countries had reservations about sharing their intellectual property rights. And that is one thing that's why I was really surprised that none of the countries raised up the other human rights issues, restrictive issues, draconian measures, which are provided for in the proposed pandemic treaty. So I get a feeling that they are comfortable with it. The powers that rule, whether it is the politicians, bureaucrats, they find it convenient to have some more powers. I mean, so to control the masses in case of pandemic without uncomfortable questions being asked. And of course, the profit motive and other things, politics also come in. And you
Yeah.
must be remembering a editorial in the BMJ also had come early in the pandemic that the science took a back seat. And that is again what is concerning in the pandemic treaty. One major provision is censorship of, and that censorship means science, censorship of science. And then in a crisis of like a pandemic, you require all alternative views. Therefore, then only the science becomes stronger. The science becomes stronger by disagreement. And that you have seen in the pandemic, they got the science wrong. And the people who are having the alternative views, they got it right. But now the ego comes in to admit that they were wrong. So the same thing will happen again in the pandemic if treaty comes in force.
So I guess the question still comes down to 2 points. One, is it ever right to censor anybody, even if what they're saying is clearly completely wrong? And
Certainly
is it
not.
ever right to mandate something like a vaccine?
Never, sir. Philip, because the science, science is always, you have got a tool of exploration, you have got a tool of data. If somebody says something which you don't agree with in science, you ask that person to provide the data or to provide the evidence. That person provides the evidence and you provide a counter evidence, that only the thing gets settled. And if it doesn't get settled, that's fine. It is uncertain, and uncertainty is part of science. Uncertainty is a part of science. When science moves towards certainty, it moves towards dogma and faith. It moves away from the science. Science, there is an element of uncertainty. Censorship kills, and it censorship amounts to dogma, faith. That is certainly not science. We are taking back science that way, and that is the worst part in the treaty. And you have a tool to counter that person. And if you can't counter it, he also can't counter, he or she. Both are on the same level. I mean, there is nothing gives you a right to silence that person. If you can't give evidence against whatever he or she has said, how much outlandish that person may be, you establish it. So that is how science progresses. I mean, there is no censorship. There's always a hypothesis and an alternative hypothesis. There's never a certainty is going towards dogma and fanatism, which unfortunately has occurred in this pandemic. There have been experts who said, Ki, I am science. If you criticize me, you are criticizing science. So that is becoming a high priest of science. So, I mean, that is something which is kill
Yeah.
science.
So when we look at where we are now, because one of the concerns is that the WHO wants to have more power in the context of a pandemic, but has it done a proper audit and appraisal as to what was right and what was wrong from this pandemic? Is it right to do any more changes without that being done?
That has to be done first. That actually, that World Health Assembly should have been deliberated this instead of wasting time on a hypothetical pandemic and a hypothetical treaty. The treaty is certainly not hypothetical. Treaty is a instrument of power and a hypothetical pandemic. And so first, we learn more from our mistakes. If we have made mistakes in the pandemic, we should scientists would sportingly admit them and become stronger. And then only that gives him the authority, the moral authority to plan for the next pandemic. Without doing a audit appraisal of what went right, what went wrong in the current pandemic, the WHO is not working scientifically. It is working. One would also suspect that it is trying to cover up its mistakes, which a scientist shouldn't do, which is not good for science. And all through, there have been censorship and there have been deplatform other scientists who are having other views. So this is the time when we should come all on board Instead of polarization, conflict, there should be collaboration. So then only we can move forward, and there shouldn't be any unholy haste to pass the pandemic treaty in haste. Tomorrow, most likely, it will not be passed because WHO itself has admitted that there are certain problems in consensus. But again, it will be pushing subsequently also. So should be no hurry. I mean, the from 2005 was the last amendment. So almost 20 years we did not have any amendment. Nothing happened. The sky did not fall, and we are becoming better with more advances in medical technology, health technology. We will be able to handle pandemic better with technology rather than with treaty. Treaty is a bureaucratic thing, and bureaucratic things is suffocating. It takes away your creativity. You make a treaty, it takes away your creativity because you are given 1, 2, 3, 4 guidelines. Whereas science is always uncertain. Science is unpredictable. What will happen in the next pandemic may be entirely different. So this science should advance by technology, by health technology, by exploration, rather than by treaty, which is bureaucratic and political.
So, one of the things that puzzles me is why are they so sure we're going to have another pandemic so soon? Because when you think about it, before this COVID pandemic, the last pandemic was it? I think there was a flu one in 1970s, and then there was the 1918.
No,
Um,
that we shouldn't compare 1918. That we didn't have antibiotics. Also, we didn't have any that for the First World War. So those we didn't have. See, after viral infection, the pneumonia, secondary bacterial infection, many people died. That scare was given in this pandemic. Also, we cannot compare 1918 with 100 years back with.
so
So
why
that's
are they worried about a pandemic now when they happen very infrequently, unless there is some knowledge that they have that they are not sharing?
They have made the treaty. No, they have to use the treaty. So that there's something like the I don't know if I read somewhere. I think old Greek mythology. There was one Procrustes. I think bed of Procrustes. He had a bed, and he had to fit everyone in that bed. So if the person was shorter, he will pull the person, and if the person was longer, he will cut the legs. So that was the bed of Procrustes. So that is how the WHO has made a treaty. Now it wants a pandemic to fit into that treaty, and somehow it will stretch and put it into that. And as I said, a lot of interests are there. There is an interest of WHO, which is supported by pharma industry, because if there is a pandemic, actually this treaty, if you see, the treaty was drafted during the pandemic. When we are dealing with a pandemic, we are not over. We have yet to take a breath. The first draft came out in just. So that is not the time to think coolly and plan a treaty. That is perhaps it raises questions about the intentions of WHO because the people were shocked and in panic. So they would accept the politicians in many countries, the political leaders have also panicked. They would have, they were in a position to sign anything to save from the next pandemic. So that is not a time when things went to chaos and anarchy and so many things, people. And so they should think take a pause, see what went right, what went wrong, improve the strong points, and then make a treaty, if at all. As I said, science doesn't go by treaty. Treaty is a sign of bureaucracy. Science goes by exploration, serendipity, and how can you predict? As you said, how can you predict what would be the next pandemic? So,
Do you think that any of this has anything to do with this bird flu news going around? So that because I'm trying to see, you're quite right. There is no urgency to get a pandemic treaty because pandemics don't usually happen that frequently. So, yes, there should be appraisal, there should be a pause, a reflection, and then out of that, a treaty coming in the future. Do you think that because politics plays such a strong role and the media, is the world being pushed into panicking that they have to therefore make this arrangement now by all this stuff about bird flu?
I think so because before bird flu, we had a panic of monkeypox also, which again, uh, And in fact, I was studying how monkeypox came out in number of countries simultaneously. I mean, in the Western countries, Spain and UK, Europe, USA, lakhs of cases, but did not come up with clusters in this native Africa, or even in Asian India. We had hardly 10, 12 cases of monkeypox. Highly crowded countries, we didn't have monkeypox. So, but monkeypox came up, and what was fascinating me as an epidemiologist was that if it is to move from person to person, it should go from one country to other and then other country, like. But simultaneously, everything erupted in so many countries in Europe and so many countries, USA. WHO director declared a public health emergency, but then it became silent. Of course, there were not much deaths, hardly, I think, 100, 200, but number of cases were very high, more than lakh cases in many continents. But what was surprising, what all these cases were in very highly vaccinated countries. So that raises some, because I have been also seeing number of cases of herpes, that is called, that after chicken, herpes zoster in vaccinated people, or something to do with immunity or something. And I don't know whether those herpes zoster were diagnosed as monkeypox or whatever, I don't know. But something very peculiar happened. And as abruptly as that, it was declared that it is no longer a public health emergency. So many things are happening which we are not investigating properly. And we are jumping to the next pandemic, as you said, bird flu. It may, I mean, they are looking for some sort of emergency to justify the pandemic treaty and acceptance of the pandemic treaty by world governments. And I think most of the governments are, I don't see any strong opposition except for few parliamentary and one odd. But by and large, people are just going with it. And whatever objections have come from governments are there on things which are not very objectionable, like equity and other things. But the major issue.
Mhm. I was just going to say, as you said that, I remember reflecting on one of the most unusual things about the pandemic treaty is that governments across the world, politicians, are willing to give up certain degrees of autonomy and power for this treaty, seemingly not in exchange for anything else. I can't think of a place where a politician is not doing a quid pro, if I'm doing this, I want this. How in the world did this many politicians suddenly just go along with this? Only one or two are raising questions. I find that completely unbelievable.
They are getting something, may not be getting above the board. They are getting, because a lot of, even in democracies, they require a lot of this election campaigns and other things. If you are knowing something about electoral bonds in our country, India, we have just had elections. The court had to declare the electoral bonds are contribution by private players to these political parties. So they get something.
And so this is where the conflicts of interest will come in that are hidden. Because yes, I think on reflection, as we pull back from it, I think what you have said that is most relevant is that there isn't an urgency. There
Another
shouldn't be an
thing,
urgency.
another aspect which somebody communicated, like they are neglecting the health services, the public health services, particularly in a country like India. So these private players, now everything is getting privatized. The hospitals are getting privatized, and the services and all. So these private hospitals and all, they are also backed up by the pharma companies. And so at least the people get some health through the private sector. And the politicians are shown to be doing something for the people. They are getting them vaccines, they are getting them pharmaceuticals, they are promoting pharmaceuticals, they are promoting vaccines, rather than improving the public health services, which will require more effort. So the public hospitals are in poor shape, the primary health centers are in poor shape, the government doctors are in short supply, they are overworked. So the politicians get to show the people, yes, I have brought so much of medical aid. Maybe private foundations, Gates Foundation or other foundations. But people get some aid. I mean, that's what my colleague working in this foundation told me. The governments in many countries have neglected the public health, they neglected the education. So they have got, these are the only people who are giving them some medical aid.
As we're coming towards the end, Amitav, one of the points that you had made early in the pandemic, and it's interesting that it was not addressed. And even when you think about the responsibility of the WHO, this is why I'm questioning, are they operating really from a scientific base? We knew that obesity on its own was probably one of the most significant independent risk factors for severe COVID-19. Have you seen anybody taking on obesity in the sense that there are public health campaigns, exercise, dealing with food industry, all of these things that could have made a difference to the general health and well-being of the population? What are your thoughts on that?
This has been neglected at the population level, and it's very important, particularly for countries like developing economies like Brazil and India. Brazil has almost crossed that point. It has as obese as the Western countries, because I had noted the data. The overweight percentage is almost similar to the Western countries, Brazil, and that's why that had very high mortality. Indian middle class is moving towards that, and nobody made campaign for obesity to be controlled except in UK. If you remember, Boris Johnson started running after, I think, he was obese, and I think Asim Malhotra advised him that you are obese, and I think he started cycling or running it for some time. So but as a population level, because the other industry, the fast food industry and sedentary lifestyle, they are also picking up very fast, and now we have got a, I think, future $1 billion market for anti-obesity drugs. People are becoming passive again. There also pharma is coming up. Now you say obesity is a risk factor, the obesity drug will appreciate the market shares. So the sale of people, the developed countries will start collecting all the obesity drugs, anti-obesity drugs.
So, as we're coming to the end, my thoughts are, and I want you to put your closing statement as well, Amitav, is that I think that the principle, the premise of getting equity in the context of a pandemic or even a significant epidemic is a very noble and wise thing to do. And we have seen from the pandemic that countries always will try and hoard the resources if they can. So we do need an organization to try and get equity. The point, though, is this the appropriate time? This is like going to the supermarket when you are hungry. You will tend to buy stuff that you don't need. And in the same way, trying to do the pandemic treaty in a time where people are still afraid and still recovering from the trauma of the pandemic will make them more likely to make mistakes in protecting their interests. What are your final thoughts on this?
Exactly, Philip. I agree with you. As I said, this is the time when we should do an introspection. What went right, what went wrong, without holding anyone. I mean, trying to blame or shame anyone, because then they go on the defensive. And future planning for pandemic should, the scientists should be at the forefront rather than bureaucrats. And the WHO also needs a proper overhaul in the scientific temperament, and if need be, they should be funded by governments rather than private players, because the conflict of interest is a very serious aspect. And so that is the way forward. And the scientists also should be at the WHO who do not have serious conflicts of interest. I am afraid which is not so at present.
Excellent, excellent. Well, thank you very much, Amitav, for sharing your knowledge, your wisdom, and I hope our listeners will get something of value as we come into this next phase. We will see what happens with the WHO pandemic treaty, but let's hope that they take the time first to do the appraisal, recognize what was right, what was wrong, and then in time think about ways to balance the equity. Thank you very much, Amitav. Have
Thank
a
you,
great
Philip. Pleasure.
All right.
Thank you.